Good morning.
Good morning. Susan Richby, Director of Legal and Governmental Affairs, Access Health CT.
Good morning, John Carbone, Director of Small Group Product Development and Broker Support, Access Health CT.
Good morning, everyone. This is Glenn Jurgen, Director of Human Resources with Access Health CT.
Good morning, everyone. Tammy Hendricks, Director.
Preamble to this next order of business.
Absolutely. Thank you, Paul. Susan Richby, Director of Legal and Governmental Affairs. This morning, we have a vote on the agenda for vice chair. This is something that the board is required to do every year per the bylaws, and we always do it in January. So this is the time for it. And I believe there is someone from the board who may like to nominate an individual to be vice chair for this coming year.
This is Tom McNeil, and I'll take the pleasure of nominating Paul Philpott as our vice chair of Access Health Board.
Thank you. And I guess if anyone else wants to nominate anyone else, or it can go over to Paul to call the motion for the vote.
Vice chair for 2026. Do I hear a motion?
Motion to close the nominations.
Thank you.
Is there a second?
Second. Sorry.
Okay. Any additional discussion on the motion before us? Not, Mr. Vice Chair, would you like me to proceed to a roll call vote on the motion?
Yes, please.
Thank you.
Just to clarify, Martin, are we voting to close the nominations or voting on the motion to appoint Paul?
I would defer to Susan. I think we're voting on the to elect Mr. Paul Philpott.
Yes, I believe the motion, there was a nomination, and then the motion was to have Paul serve as the vice chair.
Okay.
And then there was the second. Thank you.
Charles Klippel, Paul Philpott,
Yes.
Ron Ritter,
Yes.
DJ Gifford,
Yes.
Steve Hernandez,
Yes.
Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Kathleen Holt,
Yes.
and Claudia Galtieri.
Yes.
Thank you. Motion passes.
Thank you very much. And for the next item, I'll call on Susan again for a introduction.
Thank you very much. So we have one more motion today on electing a new member to the Health Plan Benefits and Qualifications Advisory Committee. There has been a vacancy in this committee with the change in ownership and actuaries at Connecticut, and IMCare, who is the owner of Connecticut Benefits, Inc. and Connecticut Insurance Company, Inc. And he serves as the pricing director for individual marketplace business in Connecticut as well as South Carolina. So I believe he will be a wonderful addition to this committee as it does and has starting on its important work for plan year 2027.
Great. Okay, do I hear a motion to appoint John
This is
McCullough
Grant.
to the Health
Motion to
Plan?
approve John Morcula as
Marson, you want to call the roll?
And before we do that, is there any discussion on the motion before us? Hearing none, I would proceed to the roll call vote. Charles Klippel, Paul Philpott,
Yes.
Grant Ritter,
yes.
DJ Gifford,
Yes,
Steve Hernandez,
Yes.
Matthew Brockman,
Yes.
Thomas McNeil.
Yes.
Dina Berlin,
yes,
NJ Barton Reeves, Kathleen Holt,
yes.
and Claudio Gaultieri.
I'm sorry. This is Andrea. I'm saying yes. I have
Oh.
some technical issues. So I'm on
Okay.
my phone.
Thank you, Commissioner. And Claudio Gaultieri.
Yes.
Thank you. Motion passes.
Thank you, Marson. We'll now hear the CEO report from James Michelle.
Good morning, all, and a happy New Year to everyone. I'm James Michelle, the Chief Executive Officer of Access of Connecticut. I hope everyone enjoyed the holidays, and thank you for taking time to be here with us today. And before we begin, I want to congratulate Paul Philpott on his many years of continued service to Access of Connecticut. We are lucky to have him as our vice chair for another term, and also want to welcome John Morcula to the Health Plan Benefit and Qualification Advisory Committee. As all of you know, Governor Lamont and the state legislature have created a new state subsidy to help Connecticut residents who lost financial help when the federal and enhanced subsidies expired on December 31st. We are very thankful to the governor for his strong support of Access of Connecticut and our customers. I also want to share some news about the original Affordable Care Act subsidies for 2026. The increases in silver plan premiums for 2026 that were approved by the Connecticut Insurance Department substantially increase the amount of financial help many of our customers who are still eligible for the original ACA subsidies are receiving for 2026. So it made the 2026 plans more affordable, in some cases as affordable as 2025 was, because of the increased subsidies as a result of the increased premium for the second lowest silver plan across the state of Connecticut. When open enrollment finally open enrollment concludes on January 31st, we will be conducting a leaver survey for anyone who did not re-enroll with us to find out why. We will share the results of that survey with the board in the spring. Our meeting today will begin with the annual adverse selection report given by Ran Zong of Wakely Consulting. Then after that, Katie Hearn, Associate Director of the Enterprise Project Management Office, will give an update on the 2026 open enrollment period as of yesterday, I believe. We extended the open enrollment deadline to January 31st, so residents will have more time to enroll and take advantage of the new state subsidies if they are eligible. We are encouraged that our enrollment numbers are higher today than they were last year for the same time. We have had strong messaging out since July about this year's open enrollment period, which drove people to our website and we encouraged them to work with a certified broker to find a plan that fits their need and also that's affordable to them. We wanted to make sure our customers had the latest information regarding federal changes and that they knew there was free enrollment help available through Access Help Connecticut. Following that, Susan Rich By, Director of Legal and Government Affairs, will share information about the impact on customers of the expiration of the federal and enhanced subsidies, as well as the new state subsidies. Next, Susan will give an update on the Health Plan Benefit and Qualification Advisory Committee that met last Thursday. This year, upcoming year for 2027, their focus will be on affordability and how we can continue to offer customers affordable health coverage in the state of Connecticut. Mr. Chair, Mr. Vice Chair, thank you. I will conclude at this point. Wait for any questions before we get into the agenda.
Thank you. Any questions for James?
I believe Dr. Gifford has a question.
Thank
Dr.
you.
Gifford?
Thank you, Mr. Vice Chair, and good morning, everyone. Good morning, James. Thanks for that update. And I was wondering, for those of us who haven't been closely involved, if you could give an update or if a member of your team will give an update over the course of the meeting as to how we are implementing the new state subsidies. I know it was a development that came rather late in 2025, in the midst of people enrolling. So can we get an update as to how people are finding out the impact of these state subsidies and how our tech adjustments are going?
Sure, Susan. When Susan talks, she'll discuss that as well, and also as well. If you have any questions at that point, we'll address it then, both between Susan and I.
Thank you.
Okay.
Okay, any other questions or comments for James? There being none, I'll call on Susan for a introduction for our next order of business.
Thank you again, Mr. Vice Chair. Also, another item that we do every year is the adverse selection study. So pursuant to our enabling legislation, the exchange is required to study enrollment on and off the exchange in a number of areas to have an analysis of whether there is any adverse selection going on and have recommendations to the board on how to, reduce that or eliminate that. So today we have Renzon here from Wakely, who has performed the adverse selection study, and she will present the information to you. And also just to point out that in the board materials that Marcin forwarded, you have a copy of the full longer study, as well as, the presentation that Ren will make here today. So I turn it over to Ren. Thank you.
Hi, good morning, everyone. My name is Renzon, consulting actuary from Wakely. Today I'm going to presenting the results of the 2025 adverse selection study. As Susan just mentioned, the Access Health CT is required by legislation to report annually on the impact of adverse selection on exchange, provide recommendations to address to ensure sustainability of the exchange. To support these requirements, Wakely was engaged to evaluate 2 potential forms of adverse selection over 2023 through 2025 period. Next slide, please. First, we look at adverse selection between on and off exchange in both individual and small group markets. Second, we examine adverse selection between self-funded and fully insured arrangements in small group market. We did not include analysis of grandfathered versus non-grandfathered plans, since those plans have not been available in the market for several years. Today's presentation just provides a high-level summary, and more details, as Susan mentioned, are in the full report already distributed. So before we dive into the results, I want to briefly explain what we mean by adverse selection in the context of health insurance market. So in this study, we define adverse selection as one segment of the market attracting high-risk individuals compared to another segment. And we identify this by using risk scores. So a brief explanation for risk scores. So the risk score come from federal ACA risk adjustment program. The risk adjustment model uses individuals' demographics and diagnosis to determine a risk score, which is a relative measure of how costly that individual is anticipated. Risk adjustment program determines risk transfers among health insurance plans. Lower risk plans are charged to fund payments to higher risk plans. So overall, the risk adjustment transfer amount is designed to balance to zero across the market. So the risk adjustment program is intended to protect against the negative effect of adverse selection. So to assess whether the risk adjustment program is effectively mitigating adverse selection, we compare the loss ratios before and after risk adjustment to see how much the underlying risk differences are offset, which will be shown in later slides. Next slide, please. So our approach combined two components. First, we performed quantitative analysis using available data. Second, we supplemented that analysis with issuer surveys and published sources to better understand issuer experience, concerns, and potential solutions. Yeah, now I walk through the first major analysis on versus off exchange. Next slide, please. And next slide. Yeah, we start with the individual market. So in the individual market, we evaluated several indicators of potential adverse selection. Before we go through each slide, here are the elements we looked at. First, an enrollment trend on and off exchange, differences in average risk scores, and loss ratios before and after risk adjustment, and enrollment shifts across metal tiers. So this chart shows on and off exchange enrollment measured in member months in millions from 2022 through 25. The light blue portion represents off exchange enrollment, which has been declining over time. This trend is consistent with what we see nationally. In contrast, the dark blue portion shows the on exchange enrollment, which has grown steadily. This suggests that more individuals may be moving on exchange, likely to take advantage of covered CT and enhanced federal subsidies. Next slide. This chart compares average risk scores on and off exchange. Dark blue bars represent on exchange risk scores, while light blue bars represent off exchange. Overall, the off-exchange enrollees tend to have higher risk scores, which points out potential adverse selection. That said, when we look at results by carrier, the picture is mixed. Some carriers see higher risk enrollment on exchange, while others see higher risk off exchange. So this indicates adverse selection is not uniform across carriers or across the market. Next slide, please.
Can I ask
yes.
a question?
Yes.
On that prior slide? So I just want to make sure I'm understanding. We are meant to every year study whether or not adverse selection is impacting the exchange, right? In other words, we were meant to understand whether sicker people were buying on the exchange and healthier people were buying off exchange.
Yeah, actually, we are observing the opposite. Now we are seeing in aggregate data, the off exchange people are riskier than on exchange.
Okay,
But
That's-
like I
that's-
mentioned, yeah.
that's what I'm seeing, but that's the inverse of the original concern. Am I right? That the original concern was that just sick people would buy on the exchange because they would get the subsidies and healthy people would stay off exchange, but we're seeing the opposite.
Yeah, that's why I also mentioned it varies by carrier. As
Okay.
we look by carrier, some carrier have sicker people off exchange and some have sicker people on. So in aggregate overall, we see more riskier people off exchange. Yeah, like you mentioned, yeah, absolutely correct. We were expecting like more like sicker population will go on exchange. Yeah.
Yeah,
And
okay,
if
thank
I
you. I
could
just want to
just,
make sure I was reading that right.
if I could just add, Dr. Gifford, I believe most likely when this was put into our enabling legislation back in 2011, a lot of people had a thought process that exchanges would potentially attract sicker populations, that it may be attracting populations of folks that had been previously uninsured, you know, who tend to have worse health, if you will. And obviously we've been in place and the exchange has been in place since 2014. So I think we've seen a lot of shifts to in enrollment between, you know, who's enrolled and on and off exchange, and really the, as Ren mentioned, the real move towards most of the individual market being on exchange versus a small number, you know, in the individual market itself, off exchange. So.
Thank you, Susan.
Yeah, I just want to add the majority of insurers are on exchange. Yeah, so this chart shows the loss ratio before risk adjustment. Like I mentioned before, we want to compare before and after risk adjustment and see if the risk adjustment actually works. So this one shows the before risk adjustment loss ratios. So the loss ratios represent claims divided by premium and indicate the percentage of premium dollars used to pay claims. The green line represents the 80% benchmark. And we see the loss ratios vary around this benchmark, but overall, off-exchange loss ratios tend to be higher than on-exchange loss ratios. We also see that silver and gold plans generally have higher loss ratios than bronze plans, which is consistent with differences in benefit richness and enrollee risk. Next slide, please. So this is the chart shows loss ratios after risk adjustment. After applying the risk adjustment transfers, loss ratios are largely leveled and much closer to the benchmark. So this indicates the risk adjustment program is effective as offsetting differences in risk between on and off exchange and across issuers. And it's important to note that risk adjustment redistribute risk across plans and issuers. It does not reduce the overall level of the risk in the market. Next slide, please. Yeah, finally, we look at the enrollment changes by metal tier. From 22 to 25, bronze enrollment declined from about 38% to 24%, while silver enrollment increased. This shift does not necessarily indicate adverse selection. Instead, it's likely reflecting consumer preferences driven by state and federal subsidies, particularly those tied to silver plans. Next slide, please. So to summarize our conclusions for individual market on versus off exchange, on aggregate basis, off exchange enrollees have higher relative risk, suggesting potential adverse selection. However, carrier level results vary, indicating that adverse selection is not consistent across the market. So importantly, the ACA risk adjustment program mitigate most of the financial impact, so the overall sustainability of the exchange does not appear to be affected. Next slide, please. Yeah, now turn to small group market. I just want to mention that fewer than 2,000 small group members, which is less than 3% of the total small group market, are enrolled in on-exchange plans. Due to this very low enrollment, we are unable to draw credible conclusions about adverse selection between on and off-exchange small group plans. So that said, the low level of participation should continue to be monitored, particularly with respect to long-term market sustainability. Next slide, please. Now, I will discuss analysis related to self-funded versus fully insured arrangement in the small group market. So in the prior years, we faced the data limitations. Self-funded plan administrators are not required to report enrollment or claims experience, and we were not able to collect sufficient data through issuer surveys. So as a result, we relied on publicly available sources, which limited our ability to draw definitive conclusions. So for context, the self-funded plan is an employer-sponsored insurance where the employer assumes direct financial responsibility for medical claims, typically using a third-party administrator. And we also mentioned a level-funded plan in the study. A level-funded plan is similar, but involves fixed monthly payments that fund claims, admin costs, and stop-loss coverage, with the potential for refunds if claims are lower than expected. So we started our review by looking at the small group fully insured market enrollment to determine if there are any changes which could be caused by adverse selection. As you can see from this graph, the number of policies has followed an annual decline of roughly 8 to 12% in recent years, including a 9% decrease in 2024. And this is not unique to Connecticut. Small group enrollment has been declining nationwide. Next slide, please. Then we reviewed the annual Kaiser Family Foundation's Employer Health Benefits Survey, which included about 1,800 employers in 2025. This chart shows the enrollment as percentages in self-funded and level-funded plans over the past 4 years. The bars on the left show self-funded plans. Note that the percentage increased to 18% in 2025. Part of this increase reflects a change in the survey population, shifting from employers with 3 to 49 employees in prior years to those with 10 to 49 employees in 25. So that 18% should be dampened because of the population change. The middle bars represent level-funded plans, which continue to be more common than pure self-funding among small employers. The bars on the right show the combined total of self-funded and level-funded plans, which has remained relatively stable between about 39 and 44% over time, although we observe a small increase each year, except in 2024. So based on the available information, next slide, please. There is insufficient data to draw firm conclusions about adverse selection between fully insured and self-funded small groups. Carriers did not report clear evidence of significant adverse selection in the survey. However, the decline in fully insured enrollment and the financial incentives for lower risk groups to self-funded raise reasonable concerns, and continued monitoring is recommended. So that concludes today's presentation. Additional detail and supporting analysis are available in the full report. And I'm happy to take any questions, if any, and thank you so much.
Any questions for Ren? Okay, there being none,
Okay,
can we get a motion to accept the adverse selection study?
So move, Deidre Gifford.
I'll second
you.
Kathy Holt.
Thank you. Any further discussion? Marcin?
Charles Klippel, Paul Philpott,
Yes.
Ron Ritter.
Yes.
Ritter. Thank you.
Yes.
Deidre Gifford,
Yes.
Steven Hernandez,
Yes.
Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Claudio Galtieri.
Yes.
Thank you.
okay, thank you, everyone.
All right, thank you. The next order of business is an open enrollment update from Catherine Hearn.
Thank you, Mr. Vice Chair. Good morning. I'm Katie Hearn, Associate Director of the Enterprise Project Management Office at Access Health Connecticut, and I have a brief open enrollment status update for you today. As you know, the open enrollment period has been extended from January 15th today to January 31st. And accordingly, we've adjusted our Access Health call center hours. They have been extended and will be open Monday through Saturday. On the last day of open enrollment, Saturday, January 31st, the call center will be open until midnight. And if anyone is attempting to contact the call center at that time and is unable to reach Access Health, they will be given a call back on the next business day and will be given an opportunity to enroll. Eligible customers enrolling anytime in January will be granted a February 1st policy effective date for their qualified health plans. Next, please. Thank you. Additional marketing and outreach efforts have been planned for the open enrollment extension. Access Health Connecticut has participated in press conferences and has been interviewed by various major media outlets regarding the extension. The extension has been communicated through a variety of digital channels. Our enrollment partners have been notified directly, such as our brokers and certified application counselors. Our paid media has been updated to reflect the open enrollment extension, and we've focused heavily on digital advertising. And finally, the mobile enrollment and outreach specialists will be available for several additional enrollment events during this extended period in January to answer questions and assist with health coverage applications. The enrollment events are listed on our website. There's a enrollment dates calendar. Next, please. Moving on to our enrollment numbers. This slide shows our enrollment numbers year over year as of January 13th. We see a large increase in qualified health plan enrollments without any financial assistance. Qualified health plan enrollments without subsidy were at 31,449 as of January 13th, up more than 100% over last OE. For some context there, approximately 27,000 consumers with income over 400% of the federal poverty level lost eligibility for subsidies due to the expiration of the enhanced premium tax credits. And currently we see a dip in qualified health plan enrollments with subsidy. The enrollments were 118,647, about a 10% decrease from last year. However, the Covered Connecticut program on its own has seen substantial growth. The enrollments, this open enrollment, were at 49,597, an almost 23% increase over last year. And our standalone dental insurance plans are also growing year over year, with enrollments at 17,697, up 5.7%. Thank you. That's my update, and I'll pause here for questions.
Mr. Vice Chair, I think there's a question.
Yeah, I had a question. This is Tricia Dove. You had mentioned that the 25 policy year, the difference at 26, it's not really apples to apples because correctly, as you stated, the federal subsidy situation changed, enhanced subsidies expired. Does the 26 policy numbers also reflect the Connecticut subsidy? So if you lost the federal subsidy, but now you have the Connecticut subsidy, you would be included in the second bucket there, or is this just referring to the federal subsidy?
At this point, it's just federal subsidy at this point.
Okay, so if someone's going to receive a Connecticut subsidy, so you might see a little bit more shift back then after, once that's, yeah.
Right, more than likely on the first line, the qualified health plans without any subsidy. Right, that's where that would be reflected.
Okay, yeah, and so in general, when I look at this, if it hadn't been for this subsidy issue, it's like, well, why are all these people without subsidies looking to get insurance more than the past? But it's mostly looking like it's pretty much just a shift because of the change and the expiration of the enhanced subsidies here, with a slight increase overall, as James had noted, in enrollment in total. I would note, I was on a call yesterday and heard from a bunch of states in New England. And what I was hearing, there was no firm numbers given, but just generally speaking, most of the states were reporting a decline in overall enrollment. And Connecticut kind of stood out, and that we're seeing so far an increase. So that's it. Thank you.
Thank you. Any other questions or comments?
I think Claudio has a question.
Yes, thank you, James. And I think just piggybacking on Trisha's question, what would be really helpful is if in that first row, when we talk about qualified health plans without subsidies, if we could break it down by FPL, because that will essentially give us some indication, because that 400 to 500 may be eligible for state subsidies now. And I'd like to see this cohort in a more granular, to see those that had subsidies under the enhanced subsidies that previously existed, and where maybe different consumer behaviors changed at the FPL band might be really helpful here.
Sure. So, Claudio, we've done that calculation in two parts. Number one is, of that 31,449, how many of them are between that 400 and 500%? But we also have a number of folks that fit into that band that have not come in and enrolled yet, and we've looked at them as well. So we have those who have already purchased and those who have not purchased yet. So we have those numbers. We're sharing with you and the board. But what we are doing then, I mean, I'm getting a little bit ahead of what Susan's going to talk about. We're doing a lot of outreach and communication with that group, with both groups, to get them to come back in and make them aware that there's more subsidy available. They could afford to buy something a little bit more, that provides more coverage. So again, we have those numbers. We'll get them to you and the board later on this morning or this afternoon. But again,
because even for example, in that first category, I know that HR1 categorically disqualified people making under 100 FPL. So I would imagine that group has gone down from maybe 5,200 to 0. But it would be interesting to see if that's really what happened. Like, we have a lot of hypotheses for how people have been different price sensitivities and different consumer shopping behavior, and it's such a different cohort to be under 100% of FPL versus 700 or 600% of FPL that may have had a very small subsidy previous.
So as you know, Claudia, every year when open enrollment closes, we do a complete analysis of all of our customers. Everything you're asking us now, we're going to do. We do that every year, and we report it back to the board after open enrollment closes. But now this year we're looking at those who are impacted by the state's subsidy earlier. So we're doing a lot earlier because we want to know who's impacted, so we can start doing a lot of outreach to them now. But the question you are asking, we do that every year. A total analysis of all of our customers, what changed, and who's impacted most. And we do it every year, and as we've done in prior years, we'll do it again, and we report back to the board. Hopefully at the March-April meeting at the latest.
And if I could, sorry, James. Oh, sorry, if I could just add in response to what James is talking about and to Claudio's question, I believe we've shared this with the board in the last few weeks. Rebecca and her team have done a great job of tracking populations where they fell on the income spectrum, if you will, in 2025 and where they have landed so far for 2026. So we do know, to your point, Claudio, about the 5,300 that we knew we're going to lose, potentially lose federal financial help because of the changes from HR 1. Some of those folks have actually moved into having income above 100% of the FPL for 2026. So some of those folks are still covered. Some of those folks have moved into covered Connecticut, et cetera. And we've seen the same kind of movement, if you will, for the over 400% losing potentially, from what we knew in 2025, losing eligibility. And I think we've shared that with the board, but in a previous set of enrollment information that we shared in the last few weeks, but we can definitely get that to you because we've been tracking that. And to your point, been very interested to see, where folks move. Some folks over 400 of the FPL from 2025, even with no income change, actually became below 400 or up to 400 just because the FPL level changes each year. So some folks who are really close to it, actually just by virtue of the FPL chart changing, fell into the bucket below 400 or up to 400. So still were eligible for federal subsidies. So there's a lot of, movement in those groups, but we're really tracking them. So we can share more, but I think we shared some of that in the last batch of information that we sent to the board.
Right. And I think I've been sending information to the board on a weekly basis. A lot of data about enrollment results. We will send an updated, Claudio will send an updated report to the board later on this morning, and we'll spike out and answer your question.
James, this is Paul. I have a question, and that is on the qualified health plan without subsidy, the change from 15,000 to 31,000. I mean, that's basically because of the lost additional subsidy. Is that right?
Correct. For the most part, yes.
Okay. Right. And prior to the additional subsidy, that number was running about 20 some odd % of the enrollment population, isn't that right?
Correct.
Yeah. So we're basically kind of.
I think it may have been as high as 30, Paul, excuse me,
years.
before 2021.
Yeah.
I think it was
Some
closer
years.
to 30. And then we had obviously a big shift since 2021 and also the Covered Connecticut program as well.
Right. Right. Okay. I guess I'm just thinking that this number is now kind of reverting back to a norm that we expected prior, if you know what I mean.
Yes, Paul. Definitely, we're going back to pre-COVID or pre-enhanced subsidy levels.
Right. Right. Yes.
But I do want to say that the Covered Connecticut program has really been a shining star. Has been very helpful to Connecticut residents at the lower economic scale and who do not qualify for Medicaid. It continues to grow every year. I know we do a lot of outreach, we spend a lot of energy and time and resources for a lot of in-person events, which is where one area where a lot of the population come through. So I will obviously continue to do that, but and also this past year, open enrollment, we've had a lot of folks have come in. We've increased the number of fairs, in-person events that we have. We've gotten a lot more attendees in those events, in-person events, and a lot of questions are asked. We always have brokers available to answer questions as well. We think that also has helped with without subsidies. But our brokers John and his team developing our brokers and making sure our brokers are available to answer questions, to help people pick plans that fits their need in the environment that we're in. That also has been very helpful in helping us to sustain our numbers. But by far, the biggest contributor to us was the large increase in second lowest silver, which drove up the subsidies for everyone below the 400% or lower. They really benefited from the increased subsidies as a result of the large increase in the and one of the carriers, the second lowest silver plan across the 8 counties that we're in.
Right. So I think one point that I'm kind of teasing out of this is that despite losing the subsidy, these people didn't just go away. They continued to maintain their coverage through the exchange.
Paul, I'm just looking at our last memo that has a little bit more detail from the end of last year, and I'm not quite sure that's true because we've seen such a big increase in covered Connecticut. So my guess is that the overall decline in people with the more traditional enrollment, i.e. not covered Connecticut, that decline is masked a little bit by the very large increase we're seeing in covered Connecticut. And I think maybe to Claudio's point is it would be good to see that all kind of teased out, you know. And so we can see what's happening to quote unquote traditional enrollment versus covered Connecticut versus dental.
Yeah, I agree. I think that would be helpful. So, okay. Any other comments or questions? Okay, thank you, everybody. And the next order of business, I'm going to call on Susan Richby for to talk about enhanced subsidy changes that impact Connecticut residents. Susan.
Thank you very much. And in this presentation, we'll also touch on what James mentioned, some more detail on the state subsidy as well. So as everybody probably is aware, on December 31st, 2025, the enhanced premium tax credits that had been in place since 2021 did indeed expire. So what did this mean? The largest impact was for consumers with income over 400% of the federal poverty level who lost eligibility for any federal financial assistance at this time for 2026. And that's, you know, something we've been discussing right here just now. So consumers with income between 100% of the federal poverty level and 400% are still eligible for federal APTCs, but it reverted back to the original ACA contribution percentages. So the contribution percentages got a bit less rich, if you will, for this population. And as Claudio brought up, unfortunately, the folks with income who are lawfully present but not yet eligible for Medicaid, who had income below 100% of the federal poverty level, lost all eligibility for federal financial help in 2026 under HR 1. That was actually separate from the expiration of the enhanced subsidies. But a bright note, sort of, if you will, as James mentioned, we actually, because of the premium increases in silver plans for 2026, this had a very positive impact on APTC calculations for many consumers between the 100 and 400%. So as Tricia mentioned, we've seen very sort of different enrollment activity for 2026 than some other New England states, as well as some other states across the country. So if you go to the next slide, Marcin. Oh, thank you. So what else is going on in this realm on the federal enhanced subsidies? There is a lot of activity that continued. It didn't end as of December 31st, 2025. And actually on January 8th, the U.S. House passed a 3-year extension of the enhanced premium tax credits. 17 Republicans joined with the Democrats to pass this extension in the House. It now has moved to the Senate for consideration, and there is a lot of negotiation going on now in the Senate. The latest that I have seen is that the group that is working on compromise legislation may not be presenting it until the last week of January. January 30th is a big funding deadline for some of the federal funding for some of the federal government. And they do go into recess, I believe, next week because of the Martin Luther King holiday. So I don't think the language from what I have seen will be presented till after they come back. But we've seen different things, potentially a 2-year extension versus a 3-year extension, as was passed in the House, with perhaps some changes to the way the subsidies are structured. So we will keep our eye on that and keep the board up to date about any movement there. So if you go to the next slide, Marcin. So the state subsidy, which everyone is very interested in, as James has mentioned, we are extremely grateful to Governor Lamont for stepping in with the state subsidy here. So the state subsidy program will be for certain consumers to help fill the gaps that were caused by the expiration of the enhanced subsidies. So the governor has chosen 2 different income tranches for the state subsidy. One is consumers with income between 100 and 200% of the federal poverty level who are not enrolled in the Covered Connecticut program. And for that group, the subsidy will replace up to the full amount of the expired enhanced subsidy. And also for consumers with income over 400% of the federal poverty level and up to 500%, who, as we've been talking about, unfortunately lost their federal financial assistance. This state subsidy will replace 50% of the expired enhanced subsidy amount. So obviously, for that population who's in that bucket Katie mentioned as having no subsidy, this will make a big difference for those folks as well. So we are working very closely with the Office of Policy and Management, the Department of Social Services, and the carriers and the Office of the Governor on the implementation of the state subsidy program. Due to the time that it takes to put things into the system, the plan is to start with a manual process, which is what we did when Covered Connecticut was passed in 2021, and we needed to get it up and running as quickly as possible. So we are working on finalizing all of the details with all of those folks as we speak, so that we can get that in place. And because obviously consumers and everyone is very interested in this program, we wanted to get information out as much as we can to folks before it is in the system. So what have we done? So we have put a letter out that dropped in the mail this week. Consumers should have started receiving that. We mailed to just under 40,000 people. We looked at all of our different audiences of folks who might be eligible for the subsidy based on what's already in their application. Some folks could be eligible but need to come in and make some changes on their application. And some folks that we know were enrolled in 2025 have not yet enrolled for 2026. So we wanted to reach all those different audiences. So we mailed to a very large group. This information is also up on our website, and we have gotten it out to brokers, navigators, and CACs, and obviously our call center as well. So everyone can see what the dollar amounts look like for those 2 income bands that I just mentioned, and how the process is going to work. The information is going to go over to the carriers, and they will be making premium adjustments for folks. So they will see that in updated premium notices from the carriers, and Access Health CT will also be sending them notices as well. So we're trying to do everything we can to help everyone understand this new financial help that's available and to get everything in place as quickly as possible.
Dr. Gifford, I think your question was about what do the customers see? I think, correct me if I'm wrong, if they go on our website, try to enroll, at this point, our system has not been updated to reflect the state subsidies. It just takes the minute the governor announced this, we reached out to our vendor who updated our system. They gave us target dates mid to late March and early April. So we've been squeezing them, pushing them down as much as possible to get it as early as possible. Unfortunately, we have an old system that requires a lot of testing. That takes a lot of time to get things done. And that's why we have a project where we call 10 clicks to update, to create, to have a system that's more efficient, more effective to absorb changes a lot faster. It's also very expensive to maintain because the system is using outdated old technology. So our vendor who built the system that we have in place now, the dates they've given us goes out into mid-March to get the system to reflect. By the way, we went through the same process with the Cover Connecticut. So we had a manual workaround until the system was up to was ready to go live, so that it could reflect the net premium. And right now, that would not be available in our system until it's up and until our vendor is complete the all the work that's necessary, or the testing that's necessary, so that the system is not damaged by the work that they're going to do.
Thanks, James. So understood on the system challenges. Is there a banner or some kind of other than the letter that Susan referred to, is there something that notifies people that they may be eligible for additional subsidies and to call?
Susan, you want me to?
Yeah, we do, Dr. Gifford, as I mentioned, we have information on the website. So what we did was we put a banner on the top of the website that mentions the OE extension to January 31st, and then it's got a link to the article that has all of the information that went out and all these other communications. Interestingly, what we're finding we can do data analysis to see how people get to different web pages, and there's a lot of traffic going to the article to read the information, but very little of it is actually coming from the link in the banner. I think people are Googling and they're getting to the website, they're getting to that page through just a Google search, it seems like. But we are tracking that, and there is a lot of pairs of eyes, if you will, looking at that on there, which is great news. That's what we wanted. We wanted to get the dollar amounts to people so people could look and say, oh, that's me or that's not me, to see this is going to apply to me. And then to give people information for those, as I mentioned, there are some folks that need to come in and make some updates. For instance, the subsidy will not apply if you're in a catastrophic plan. So for anyone who may be eligible, who selected a catastrophic plan, we're giving them the opportunity to come in and change their, plan selection to a bronze, silver, or a gold. Some people who knew they weren't going to be eligible for a federal subsidy this year may have changed their application to say they were no longer requesting financial help. We need them to put that back and say that so that it can go through the verification process and some other steps. So that other information was in the letters, and it's in a call out box in the article as well, so that people know they can look and see, oh, did I do that, or do I need to come in and do something else, to be as helpful as possible. And obviously for the brokers and navigators who are working with folks as well.
And Dr. Gifford, the communication has been nonstop, relentless, ongoing, and not just through our website, but direct targeted email. Those who could benefit from this, we are tracking this on a daily basis, and we're doing texting if possible. But we're sending notices to everyone. Our website continues to be updated to reflect everything that Susan and I have said to you.
Yeah, and like I said, we did mail to almost 40,000 people. And thank you, James, for pointing out there are also emails for everyone that we have email on. There are emails going out with the same information this week to make sure that we, do everything we can to reach folks.
And also one final, I think Susan mentioned this, but I think it's worth mentioning again, when we start sending files to the carriers, the invoice, the premium bills that the folks will get will reflect the net of federal and state subsidy.
And they will credit them if they've paid, you know, their full premium in January and they're entitled to a state subsidy now for part of that premium. They will be putting a credit on, and that will all be reflected on their bills. We've been working with the carriers on that as well, so they've been really terrific in that front.
Okay.
So short of, short of our system being updated, everything else we can do, we are doing it because this is all about our customers. How do we make health insurance affordable to continue to be affordable for them? So we will continue to explore every opportunity to communicate, engage with them, to get them to our website, and get them to come back and also work with our carriers, our partners, our brokers to continue to support our customers and again continue to lower premiums for them.
James, did the state give, or did the state name a total amount for this program, or an up to amount, or is it did they just name the parameters of who was eligible, and then whatever that cost is what the state will backfill?
No, they have a number. I would ask Claudia to comment on that, but I think it's around $50 million, $50+ million.
Correct.
James, I can comment on that. So, Dr. Gifford, there were several investments that we requested out of a set aside of $500 million. There was special act language passed by the legislature that allowed the governor to draw down from an emergency reserve fund for action or inaction by the federal government. We identified in our first request for drawdown a number of things that supported both Covered Connecticut, because the expiration of the enhanced subsidies did result in significant additional costs for Covered Connecticut. The anticipated amount of that for both FY26 and FY27 was $64.1 million. So we've asked for that to be shored up through this so that we can continue that program as a zero premium, zero out of pocket for the full biennium. The next piece was $2.6 million. That supports the estimate of individuals between 100 and 200% that are getting the full subsidy for calendar year 2026. And then the final request was the 50% backfill for the loss of enhanced subsidy between 400 and 500 FPL. And that was a total of 48.16 million. So all of this was requested, and per special act, we need to make sure that DSS is able to obligate these funds through contracts with the carriers before February 3rd. So that work is happening. I think DSS transmitted some contract language earlier this week, and we've been going back and forth on contract revisions to make sure the obligation can happen.
Thanks, Claudia.
All right. That was some great discussion. Thank you very much.
Shall I speed talk through this next one, as I see we're over time for folks?
Yeah, Susan.
Go ahead, Susan.
Go, Susan.
Yeah, I'll go as quickly as possible. As we talked about earlier in the meeting, the Health Plan Benefits and Qualifications Advisory Committee is one of our important, as they're all important, advisory committees, and each year the committee works to make recommendations to the board for the QHP certification requirements, primarily the standard plan designs. This committee is made up of a mix of board members, advocates, and also representatives from the carriers offering plans on the exchange, hence the vote today for Connecticut. So the first meeting, I believe James mentioned this, the first meeting for 2027 was held last week on January 7th. We are unfortunately still awaiting release of some federal regulatory guidance that we need to really dive into this work, but we wanted to get started having the conversation with the committee. And so we had our meeting last week, and one of the things we did was to review the new state mandate for that came out of the 2023 5, legislative session, which expands insurance coverage for applied behavioral analysis services for individuals diagnosed with autism spectrum disorder up to age 26 now, and then also review the certification requirements generally, and then discussed, what we've been talking about here today to really focus on affordability as well as we can with plan designs for 2027. And also, we provided an update on and we've talked about this, I believe, before the board, some changes by the carriers and broker compensation going into 2026 and what Access Health has done to make sure that there are brokers available for all consumers, as it's, vitally important to help them with their plan selection. So I will pause if there are any questions.
Okay, thank you very much, Susan.
Thank you.
James, did you have any comment on future agenda items?
Just a couple quick items. Number one is we are currently, the finance team is looking at the FY 2027 operating budget, which will be going to the finance committee in April. But again, we'll start talking with Claudio as soon as possible, make him aware what direction we're going. And also update on the big project 10 clicks, looking at replacing the current system that we just talked about, the limitations it has, the cost of running it, and how much time it takes to make any changes. We are looking to create a new system that's more efficient, more effective, and a lot more easier to manage and make changes to. Because as we all know, every year since we've been in existence, every year there's 2 or 3 big changes that we have to put into our system. They're very expensive to put in, but also takes, more importantly, it takes a lot of time to make any changes to our system, because the way our system was designed, everything is inside this one big box. To make any changes, though, you have to open up the whole box, make the change, and before you close the box back up, you got to test everything to make sure you didn't damage something, which could damage a whole bunch of other things within the system. So that's why it takes so long to do. In a new environment, you will have a more modular approach. We have modules for different things. So if you have to make one change, just unplug that one module, make the update, and plug it back in. But currently, all the work that has to go into making a minor change is very expensive, time consuming. And so that's the 10 clicks. We are on track to get that up and running. We will keep the board. We will work with Stephen Hernandez and his team, keep them updated on that strategy, and ultimately we report back to the board as we move forward. That's all I have, Mr. Vice Chair.
Thank you, James. Are there any other comments, questions, anything for the good of the order? There being none, I'll entertain a motion to adjourn.
So moved, Gifford.
Right, second.
And a roll
So
call for
Martin, I
adjournment.
think we have a motion and a second.
Yes, we do, and we don't need we don't need to have a discussion. So I'll do that roll call. Charles Klippel, Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford,
Yes.
Stephen Hernandez,
Yes.
Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
MJ Barton Reeves, Kathleen Holt.
Yes.
Yes.
Thank you. Thank you. And Claudio Galtieri.
Yes.
Thank you. Motion passes.
Motion
Thank you all very
passes,
much.
meeting is adjourned. And thank you all for your attendance, your participation. Thank you very much.
Thank you, everyone.